hi friends. This video is probably one of my all-time most requested video of them all, and it just took me forever to do it just because I don't even know. It's just like I've went through so much and I kind of like spaced making this video, and then I just thought this is not relevant anymore, or it is, but it's like I forget details. Should I or shouldn't I you know, film this video? And I still, to this day, it's been almost a year ago since I posted the first one, and I still get daily requests for where's the second video. So we are going to talk about my last part of my cancer journey. First things first, if you are not familiar with this, if you have no idea what I'm talking about, you need to go back and watch the first video, which is my cancer journey part 1. So it talks about the type of cancer that I have. It will answer all of these questions to you guys. So please do that. And at that time, when I filmed that video, I was so... I don't know if I want to use the word eliminated, because I don't know if it makes much sense, but I just felt the light and the presence of God so strong in my life that I think that just kind of like translated into the video, and that's why it touched so many people like it did. So I'm hoping, you know, I'm praying today that it will, that I will receive this, you know, this Holy Spirit, and just be able to speak from my heart on this video, because that's what helped me to really go through my cancer journey. I have been very healthy, guys, probably the healthiest I've been in so many years, and I've made an incredible amount of small changes in my daily life. So that being said, I will touch base on all of them if I can remember. I just got like my little notepad and try not to forget anything. But yes, it's like, so I'm feeling so healthy and everything, and sometimes I feel like we sort of not take for granted, but we just we don't remember the bad times, and that's a good thing, you know. It's just like, it's good to know where you came from, to know where you've been through, and to know that you were able to come out of it stronger and better. And it's important never to forget the moments that you needed God and He came through, but it's also important to move on. And that's basically what I did. I have daily reminders of what happened to me with my scars and my implants, and the supplements that I have to take and everything. But really, in the scope of everything, guys, I was just so blessed and so lucky. So it's just beyond measure. Anyway, that being said, let's just jump into it. Okay, so I cannot remember where I left off exactly from last video. I do remember that I did not talk about the mastectomy, but I had the mastectomy already. So I'm just gonna quickly touch base about what to expect when you go to have a mastectomy, or what they call a double mastectomy, or a bilateral mastectomy, which is, the bilateral means that the scar is from the nipple out. So it will be basically, I'll just draw a little picture for you guys, like from, like, you say your nipple, so the scar cuts through it, okay, instead of around the nipple, or instead of under here, which this is your common boob job. It will cut under here, so nobody will be able to see the scar. It's just aesthetically pleasing, and it's just a way better place to be. Since I had to remove all of the tissue, then we have the cut on the sides. Some people actually have the cut across the whole nipple thing. Some people lose their nipple, so there's like a ton of different ones. So what I had was the bilateral, blessed enough to be able to keep my nipples, and if you don't feel like you're not blessed, because there's so many different techniques nowadays that you can actually tattoo a nipple and it looks perfect. And actually some women will prefer, because then they literally don't have to wear a bra. You guys, seriously, I only have to wear a bra nowadays because I still have my nipples and they do get hard sometimes. So sorry if this is TMI, but this is the kind of video that will be a lot of TMIs. So if you're not ready for this, this might not be the right video for you. Just warning right now. Okay, so part one, what to expect, or what is the mastectomy, what entitles, and da-da-da. So you go in a few days prior to your appointment. They're gonna run a blood test, make sure you're not sick, you know, getting a cold or anything like that. Make sure that your body's strong enough to handle the surgery, because it is about like a 4 to 6 hour surgery in most cases. So the first one coming, the mastectomy surgeon will come and remove the tissue, and then the plastic surgeon will go and sew back the openings, you know, so he will make the scar look pretty and neat. He will actually place the expanders before he does that. So he will place the expanders in there, and then he will sew back your skin up. So the next day you see both. You see the mastectomy, well, I'm sorry, the second day you would see nurses. So this is an overnight stay in the hospital. You get a full-on anesthesia, so you're knocked out. I just remember waking up. I remember not feeling any pain at all. And I actually have highlights of waking up and everything on my Instagram. I will try to post like them in here on the box below, or just you guys can refer back to them if you go to my Instagram at Karina Style Diaries. So when I woke up the next morning, I just remember wanting to look at myself, and obviously it's like you already know that's not gonna be pretty, you know, so it's an odd feeling. It's almost like, it's not even an empty balloon, it's like a very wrinkly, like, so how can I explain this? It's just like your skin that was, that used to be, you know, full, is no longer full, so it's just kind of mushy in there, and then there's this huge scar across from like your nipple. So it is very disturbing, I would say that. It's actually, gosh, I haven't thought about this in so long. I'm not upset about it at all. It's just, wow, I just haven't thought about this in so long, and just thinking back, I just remember looking at myself and thinking I cannot not be strong, because my mom was here in town, you know, to help me with the kids and everything, and Brian was there, and I knew that they were gonna be shocked by the way it looked, you know, and so I didn't want to be the one in shock. Like, I felt like if I'm strong and if I'm like acting like this is normal, this is part of it, this is, you know, it's gonna be great, don't worry about it, then they wouldn't have any room to be super upset either. Like, I just didn't want to cause a stir, you know, or cause everybody to just be super upset and cry and everything. And honestly, I was like, at that moment, you guys, I was so strong I didn't cry. Like, I just looked at myself and I'm like, fuck, this is fucked up. But I'm gonna be fine, you know, God's with me, I'm gonna be fine. I know that they're, you know, the whole time I just thought I'm gonna have new boobs and they're gonna be so pretty, and I'm so excited, and this is gonna be a breeze, you know. So yeah, that was the first moment, and I remember my mom was helping me in the bathroom, and obviously you're kind of naked, like you have this thing this hospital gown that closes in the front. So she helped me to take it off and you know, pull it back, put my clothes on. And I remember her face was just like, and she was trying to keep it together too, you know, so I'm just like, yeah, it's a little, you know, shocking, but it's gonna be fine. It's gonna be fine. So she kind of like, whatever she felt at that moment, she swallowed up, and it was it. Same thing with Brian. He saw it. He was, you know, he kind of like looked away. I know that it bothered him a little. Just see me. Not that my boobs didn't look right, but just see me in that state. It's just very sad for your, you know, to see a person you love kind of, you know, lose a body part, even if it's just breasts, you know, that you don't technically need. I don't need them anymore, you know, after breastfeeding my kids. So I'm not making this, I'm not trying to sugarcoat this, guys. It's rough and it's tough and it's very hard. I think that out of the whole experience, this was probably the hardest. Thank God I did not have to go through chemo nor radiation. So it was like really the best outcome possible, and that I prayed with, and so many of you guys prayed with me on this journey, and I am so forever grateful, because I know for sure as a fact that that made the whole difference. Like the power of prayer together, it's like, you know, two people praying, it's like a million together. And when there's thousands of you or hundreds, I don't know, it's just, it was incredible and I felt it. So I just wanted to register here. I wanted to say thank you so much. So after that I came home, you guys, I have allergic reactions to some medicines. I keep forgetting the name of this one. Let me look it up, because it's, gosh, what is it? Okay, just wanted to look it up, the meds that I'm allergic to. Just, I mean, this does not matter much to anybody, but just so you guys know, I react to Vicodin, so I cannot take Vicodin. I mean, I can't, I'm not gonna die from it, but I have, like, I literally flat out hallucinate from it. So I'm always like, don't give me Vicodin. So they gave me tramadol instead, which is more of like an anti-inflammatory, but it is an opioid as well. I feel like, I just feel really like this. It's just not a good feeling at all for me. I'm very hyper. I just hate that feeling of like I have no control over my body. So I don't like that kind of stuff. For that reason, I chose to just take the tramadol, because they're like, you do not want to be in pain. Like, you rather be, you know, drugged up in that case than just be in pain. So if you feel like, you know, it's wearing off and you feel like you can tolerate, then you can just take the Tylenol, which that's honestly after 2 days. After the first day, I was super drugged up. So came home and kept on taking the tramadol. I actually took it for 2 days. Okay, one thing very important that I forgot to mention is that when you have a mastectomy, they put drains on you. So you literally have on the side here of your chest, you have a hole, and so they put a tube, a plastic tube, around the expander inside of your skin, and then it drains the liquids to this little baggie. I think I have footage of that. If I do, I'll make sure to put it in here and show you guys. Sorry if it's a little too graphic, but I think it's important. I would have liked to see it if I was going through this myself last year and I didn't find anything. We are going to show you how we're draining. Today should be the last day that I'm having the drain. Hopefully we'll be able to take them off tomorrow. And a good tip for you guys is to have the hands with soap. So my mom is here with soap in her hands, and that helps to slide the tubes a little bit better so we can get through it. You have to kind of squeeze the top of it and pull everything down. Okay, bud. Well, no, keep on going down. Then we usually have a better measuring cup than this, but we forgot it at the hospital, so we've been using this because I'm not draining a whole lot. It's almost done. And then we squeeze it back. And twist it. And I've been doing this like 4 times a day, 3 to 4 times a day. So it's clean for next time. Okay guys, so another tip that it helped me a ton is to have pajamas that have buttons. So obviously when the summertime, You know, you can get some short sleeve ones, but in the winter time, you know, you can just get some long sleeve. But this is life-saving. So having pockets, I've been like walking around for the first few days with just my pajamas all day long, and this helps a ton because the drains are like here. You also have the choice of the clip, but the clip is not really strong, so it doesn't, even if you put it in here, it doesn't hold as well as having in the pocket. And this is like the buttons, it's just full easy access to having access to the drains, and also you can actually see where the drains go from here and from here. So that's another tip for you. Hope this helps. Anyway, one thing that I fully recommend you to get is, they recommended me a bra to get fitted somewhere. It was a hassle, you guys, and I did not like the bra. It was way too small for me. And I bought the extra small, or I think the small or the extra small, and I just felt like it was just suffocating me. But it's important to get a good fitted bra because you want it to be compressed, even though there's nothing in there, but you want the tubes to be in place. So you want something that would squeeze the sides, because when you sleep, and in the first nights of sleep, I remember just being like this, and I'm like a side sleeper, so I just had to like move my head a little bit like this, and I had like tons of pillows. By the way, IU Health is the hospital that I had my surgery on, and they were just so amazing. Like all the way there's this specific person that deals with the breast cancer patients, and she gifted me a bunch of like little pillows, like heart-shaped ones, so it fits like really well under your arms and just makes you stay and put in. It really helps with the recovery process of it. So like just the little details. So make sure you do have a good fitted bra and that you get yourself measured. Sometimes in the hospitals it costs a little more, but by all means it's important, and it's something that I'm telling you, it makes a difference if you have the right, you know, the right garment for the after surgery. When you come home, they had me wrapped up with like just a bunch of different things. Well, actually, no, I'm lying. This is the after that. Erase that. So yes, then you have the drains, and then the drains need to be drained 3 or 4 times a day in the beginning, and then it kind of decreases from there. So that was a good thing that my mom was here too, because then she could do this. It's plugged, or it's just like it's held by just a little stitch in there, so it doesn't really hurt. It's just weird. So that's why you have to take a set of antibiotics with it too, just, you know, to prevent infection from happening on that open wound that's going to be there for a while. So I remember like after a week, like when the liquid starts decreasing, and I had a sheet that I would mark how many milliliters it would come out of each side and the time of the day. So you kind of keep track of that, and if it starts decreasing like substantially, that's when you can take it out, the drains. So I can't remember exactly the amount that was a day, maybe like 10 or 20 milliliters for the whole day. That's when you could pull out the drains. I remember going to the doctor, and she's like, you know what, you're just gonna be miserable if I don't take this, if I take this out, and then you get this seroma, which is a pocket of liquids that sit in your breast. So the liquids have to come out, but then if there's no drains, they're gonna sit here, you know, and then just like make a little puddle. And so she said it would be super painful. Later on, I found out that it really isn't a big deal at all. So I'm gonna tell you what happened. So the cancer side drains just finished draining quicker. I took it out after a week, and she did not want to take this one out because she said it's, you know, it's going to be a pain for you if it gets the seroma. I hope I'm saying the word right. Anyway, then I kept this. So that was like a big letdown. I was super upset about keeping this because first of all, it's a pain in the ass. Every day you have to be draining that thing. There's the risk of infection, so you have to be extra super careful with what you're wearing, where the thing is touching, and then for the expanders. So then after, I want to say maybe 2 weeks or so, maybe maybe a little more than that, 20 days. I can't remember exactly. I remember I was able to come in to my surgeon. So then I had my follow-up with the plastic surgeon. I think it was 3 weeks later. And then he was able to take off the other drain, which was so easy, so much easier than when the nurse did. And then one of them had developed a little bit of that seroma, which is the liquids were in there. So it almost looked like a cute little breast, you know, because it had something in there and it wasn't just the plastic, the rubbery kind of wrinkly plastic looking thing. So then we took the drain out, great, and that was my first feel. So what does that mean? When you have your expanders, it's like this 2 bags. It's almost like, you know, if you know what a saline implant looks like, this is a really good one, you guys. So this is what it is. It's like a bag and it has this metal ring on it, okay? So with this metal ring, they want to make sure they put the metal ring to be around your nipple area. So coin looking thing stays in there and it's a magnet. So then they have like a little tool when you go to the office that will, you know, they will look for it, they will put it around your chest, and then it pinpoints where the metal thing is, and you can feel it, like you can definitely feel it like yourself. But then it tells them exactly where the needle should go. So then they come with this gigantic syringe, which it looks so crazy, but it does not hurt at all because you have literally no nerves. So there's no feelings left in your breast. So, you know, it's okay. So they poke the needle in there. And what they do is that they fill in with the saline inside of the expander. So, you know, you see your chest like growing. And then if there's the seroma around, it's a little bit harder because they have to get out of the expanders with that needle and then just pull out the seroma. Which one thing to keep in mind, you guys, and obviously your doctor is going to tell you that, like you can see signs of infection with the water that's going to come out of the. So one thing I remember on the expanders episode was having my first feel. I just felt like I literally had boobs again. It was just the best feeling ever, and they were like all funky and poking and just had kind of like a different shape. But you guys, I was just so happy just to look. I felt normal again, like there was like a little bit of something in there, you know. And it's funny because they can keep on feeling, like, so if you want to have like bigger boobs, they can try to feel like you know, a little bit in the beginning and then more and more until you actually achieve the size that you want. But honestly, you guys, for my first feel, I had only 2 feels. So my first one, I'm like, I'm fine. That's perfectly fine. I just didn't want to change my bra sizes. I didn't want to change my clothes. I didn't want to look different. I was just looking forward to have like perkier, you know, boobs than I did before. Anyway, so that was it. I only saw them like maybe 2 or 3 times throughout that period of like just filling it up, and then just had the expanders there. They asked for about 3 months to kind of like clear out the scars, make sure that it was a healthy tissue growing, and before we actually went in and put the final implants. One thing though is that they, you know, the reason why they do the expanders in a lot of cases is because they test our lymph nodes, they test a lot of like the tissue in there and see if I'm gonna need chemo or radiation, or the patient. And so for that matter is that they do this, the expander. And obviously if somebody wants to get bigger boobs and everything, they can actually feel and see what it feels like and kind of like envision themselves, you know, get a feel for it bigger, and then they can transition to a bigger after having a little bit more of a bigger size. So it just helps with that transitioning too. Because chemo and radiation are such harsh treatments, they don't want the implants to get damaged. So that's the reason why they do the main reason why they do the expanders is that you just kind of grow used to the expanders. I remember it didn't bother me much. I just remember thinking, gosh, I cannot wait for them to look smooth again, just a little bit smoother, you know, and then just having that feel of like just having normal looking boobs. Little did I know that they would just never look like very normal again, you know, unfortunately. But this is something that I'm learning to accept. So I had my surgery in July 5th, and then I had my implants, my final supposedly surgery in November 19th. So 4 months later, that's not too bad. I went in, so the implants are actually like a piece of cake compared to the mastectomy. This is just something so easy. It's like, you know, you can just definitely go through it and not think like it's ridiculously easy. I was driving the next day, literally. I did not take any painkillers, no tramadol, none of those opioids, nothing. Very easy. So it's an outpatient surgery. You go in the hospital in the morning, you do all of the exams, you know, all of the whatever, you know, surgical things. Then the doctor will come and mark you up, like, you know, draw what they're gonna do exactly, and da-da-da. We had previously talked about implant size. I was very adamant about having something that's small. So the size of my implants are just 180 cc's, which they're pretty small, but it's a full B size. For me, I just, you know, like I said, I wanted to fit into my things, and I like small chest. Women just, you know, I like the way that they look. And so if I, you know, had the choice, that's what I chose to go with. So that was previously talked about. The one thing though that we didn't agree, and it was still kind of like don't, but I'm just choosing to trust my doctor now because I've talked to, I went to look for a second opinion. Apparently I lost a little bit of the remaining footage of this video, so I just thought I'll hop in here real quick out of the office. I'm like, this is what I look like when I'm editing. So I apologize for that, but just wanted to talk about the final steps or so of this whole process of the implants and everything. So where I left off on the video was just talking about how you should ask for second opinions and everything. I highly recommend you to do this. Trust your doctor. You know, I had a gut feeling about my doctor and myself not really agreeing on how we wanted the implants to be. And I think that, you know, I respect him so much. He's a great professional, but we just had different ideas, or still have different ideas of how so basically I just wanted a very natural looking boob. And this is like, he put it above the muscle. And there's like studies right now that say that above the muscle, it's like a much quicker recovery, which I attest to that. It was definitely very, very quick. Was it better, like, in terms of looking? Honestly, I don't think so for me, guys. If I had my tissues, my boobs, and then I just wanted to have a boob job just to look better or perkier or whatever the reason, I think that that would be fine, because I've seen some implants that were put on top of the muscle that look perfect. But because I have no tissue and I have not very much fat around here, they just look very unnatural. And that was my biggest problem with it. I never had any problems with the implants. I never had any pain or any, I mean, even the scars are just very, very nicely done. So he did a wonderful job in that way. But then some of the things, like, you know, for instance, when you do these types of implants, you get fat grafting, which is a technique that they collect and harvest fat from your body. A lot of women have extra fat, and that's great, because then you can, you know, have a liposuction and look even better, and then just put that around your implants and they look a very, you know, way better, like super natural. Because I don't have a whole lot to spare, and he did take a little bit out of my, the sides of my belly, but not the back. And so they just don't look, and the fat dissolved within, I want to say, I don't know, like a month of it. There's just very, very little left. So anyway, that was just disappointing to me. I felt like I was just expecting it to be amazing. You know, when you think of a boob job, you're like, oh, I wasn't seeking one, but hey, if I can have one, you know, and it looks amazing, then why not? The thing of it is, this is not your regular boob job. This is a reconstructive surgery, and I think that that's where I was just living in La La Land for a little bit, you know, and just kind of like expecting something that I wasn't going to have, period. So I think that that was my biggest letdown. Like I was expecting something, and it didn't happen. Like it was my reward after going through all of this, and then I was just like, oh, is this how they're gonna look like? But guys, like I said, honestly, I look fine in clothes, and this is, to me, is the biggest and most important thing. They're not enormous, you know, they're normal size. I don't even feel like they look like implants, honestly, when I have my clothes on, which I'm so thankful for, because I do not like the look of it. I do not like, you know, like I said, people have different bodies and different things. For myself, I would just look very, not very good, because I'm just small bone, and it's like a petite style person. So anyway, that being said, we had our follow-up appointment. The first one, I hated it. There was a physician's assistant that came into the room and just basically told me that I needed to gain weight, you know, so I could have normal looking boobs again. And I really wanted to say that to her, but I didn't. But I was like, okay, lady, I am just definitely gonna go see somebody else. Then I went to look for another opinion, another doctor, and he basically put me at ease. This is a guy that's about to retire here in town. He was highly recommended by other people too. And he basically said, those are fine, you know, they're like really, I don't think it could do much better than this. And he gave me some options, which will be more fat grafting, which my surgeon said the same thing. Like, it's normal. Once all of that got settled in my mind, and I understood what this was, this is not like an aesthetic surgery. It's like a reconstructive surgery. Which I thought I knew that, you know, but my expectations were not of a reconstructive surgery. So I started like doing a lot of research on my own too, and like looking at things online, and it's hard, you know, and when I look at mine, I'm like, I better be damn happy that this is what they look like, because they're great, you know, compared to what it could have been. So I think that's important for us to just not be too hard on ourselves, no matter what. I just felt like I had to change things, the way that I wear, like bathing suits, for instance. You know, I used to like a certain style that they just look terrible now because the implants are so visible. So I'm just learning to kind of cope with that, and then learning how to dress again for this, you know. But honestly, in all honesty, if this is the only, you know, remaining feel of all of that happened, then I couldn't be happier. You know, it's fine. And the more, I don't know if it's just because I'm getting used to them too, I don't hate them anymore. You know, I'm just like, I'm grateful that they are here, that they look normal to me. I'm grateful that I'm healthy and I'm moving and I can breathe and I can do all kinds and all sorts of things. And, you know, I'm no longer with that cancer, and things are great. So my next step from now on will be another round of fat grafting. I also talked to my surgeon and the other surgeon that I saw, and both of them said it's normal for women to have multiple surgeries to fix, you know, like a reconstructive surgery. I actually talked to like several survivors, and none of the people that I know, actually maybe one that I know of, had only one surgery. Everybody else had 2 or more. There's people who had like 6 surgeries, and just because of one thing or another, you know, there's just different things. So I asked my surgeon about doing, you know, the under the muscle, and he's still very adamant that we shouldn't, you know. He's like, I just don't see the reason why you want to rip your pec muscle, and there's just a tiny little layer like this that it would not help with your issue, basically. You know, it might make that slope a little more soft, but is it worth the risk? and all of the, you know, all of it that it comes with. So I know that a lot of people would definitely disagree or agree with, you know, the methods. I just feel in my heart after all of this that I need to trust him, and because I feel so good, you know, and so well and so healthy, I think that this is just something that it's right here, and this is what it needs to be worked at. So anyway, guys, this was the second part of my journey with cancer. I am so sorry that this just dragged and it got so long, and I just really wanted to finish this and come here and pour it out to you with as much information as possible, so you are aware of, like, if you have any questions, please feel free to reach out. Usually on my Instagram messages or emails. Like, emails are actually better for me if you're talking about the subject, because I can write about it for a long time. But I'm gonna try. I hope that this was clarifying enough for you to what to expect, and basically just be happy where you are, or appreciate what you have, because life is just so fragile. We just don't know when they were healthy, and the other, you're just like, okay, what's going on? So I think that we shouldn't take for granted, and just be grateful for every little thing that you have that's better, because somebody else is going through much worse than you. And you know, this gratitude, this path of gratitude has been very helpful with this journey that I went through. So I just wish you guys the same, that you have gratitude in your heart, that you have a great support system. One thing though, it's all about you. So whatever, people are gonna have second opinions. I had a friend who said something about she wanted to have a double mastectomy, and her doctor and her husband said, why? You just have cancer in one. This is nobody's business but yours. I think I did say that on the other video, but it just came into my mind too. It's like, stick for what you want. It's your body. You're the one going through this. Really, nobody has any rights whatsoever to say or to throw in a line that what they want. You know, it's your decision ultimately. And be educated about it. You know, do your research, talk to other people, and come up with your own opinion. So that's it for today, guys. Thank you so much for your patience waiting for this video, and thank you so much for watching, and I'll see you next time. Um beijo. Ciao, ciao. With a much better and lighter subject, I hope.